We had an act of violence. An executive at United Healthcare was killed. And what we've seen since, there's a lot of questions, right, that are still being explored about the motive. But we've also seen an outpouring of angst about the healthcare system, anger, frustration. And I'm curious, sort of as leaders in the healthcare industry, how are you thinking about risk within the industry? And also, frankly, that response from people in the community.
So maybe I'll start. First of all, I just think it's a very sad and heavy moment. It was a tragedy of epic proportions. And you think about the families affected. And I think we're just still reeling and trying to get a handle on actually what happened. In terms of the comments online, I will only say that I think all of us are taking a step back and trying to understand what's happening with patients and their experiences. We always do that at Pfizer. I know you do that at Amazon. But clearly, there's a larger dialogue that needs to happen, and we're going to be taking our time to try to understand exactly what happened and understand that feedback and see where we can play a positive role. Vin, over to you.
No, exactly. I mean, I couldn't agree more. I mean, I'll say as a clinician that two things can be true. One is our health system needs to be better. I think we all agree on that. And there's a lot of things that, for decades, this is not new to the events of last week, which, horrifically tragic. There's a lot of things that should cause a lot of outrage by many of us. That's why we're building what we're building at Amazon, because we think that we can be part of a better solution. So there's a lot of inspiration and frankly, motivation out there to have a better system in place. And I think we're seeing the signs of that. It's also true that that should not have happened. And so there cannot be this false moral equivalence in our public discourse. And so I found, again, just me looking at this as an intensive care doc, seeing some of these inequities play out, not just over the last week, but over the last several decades, that the events of last week are unacceptable. I'm worried about, when you talk about risk, I think we should all be worried about this sort of notion, will that be normed? Is that type of reaction going to be normed, and are there going to be copycats? That is unacceptable. We need people to speak out that false moral equivalences must not be accepted. But that we should also be focused, as Carolyn said, on the bigger goal, which is we can do something better here together. That's why I know Carolyn's excited about the work that they're doing at Pfizer. I think Amazon is a part of a broader solution for a better healthcare experience. Test to treat is but one of them. But that's what we need to be putting our energies towards, not false moral equivalences.